Healthy physiology, we should see a fairly robust amount of cortisol released in the morning. This is so you wake up and you can be attentive and get out of bed and not feel like you're dragging all morning. In fact, an inversion of cortisol output can lead to daytime fatigue and then nighttime insomnia. Hey everyone, welcome back. This is Dr. Michael Ruscio. I am a clinical researcher, practicing clinician, and an adjunct professor at the University of Bridgeport with a focus and a passion for natural health solutions, mainly gut health, as someone who suffered from poor gut health myself. And today I'm very excited to share with you a paper from Gregor and colleagues that helps us understand how altered stress hormones, anxiety and depression, poor sleep, and fatigue all intersect with gut health and how probiotic therapy might be able to help all of the above. So let's jump into the paper. Again, excellent paper appearing hot off the press, January 2023 in Neurogastroenterology and Motility. And here is the quick rundown on the design. Randomized control trial with about 50 patients receiving 1 billion CFU per day of a 2-strain Bifidobacterium longum and about 50 healthy controls. What they found, recap, and then we'll unpack. Improvements in IBS, anxiety, depression, sleep quality, and cortisol levels. So let's unpack a little bit further. At baseline, what you're seeing here is the cortisol awakening response. Now, in healthy physiology, we should see a fairly robust amount of cortisol released in the morning. This is so you wake up and you can be attentive and get out of bed and not feel like you're dragging all morning. In fact, an inversion of cortisol output can lead to daytime fatigue and then nighttime insomnia. This is part of what you're seeing here. These are the healthy control groups, and Gregor and colleagues did a great job of even breaking this down to healthy controls with low stress and healthy controls with moderate stress. And you don't really see a difference between the two, although maybe we could say those with moderate stress had a little bit of a blunted cortisol output, but nothing compared to those with IBS. Abdominal discomfort, altered bowel function, perhaps some abdominal pain. They had a below normal level of cortisol output as measured by the cortisol awakening response, which might be the most accurate way to assess this. We've discussed on the podcast before a seminal meta-analysis that found adrenal testing in correlation to symptoms was poor, and one of which is the 4-point cortisol test, albeit used fairly ubiquitously in the field. Now, the one test that seems to be the most accurate is this cortisol awakening response. And again, that's what you're seeing here. Now look at this. Again, the baseline cortisol awakening response is blunted in those with IBS. After 4 weeks on a probiotic, look at the resurrection. A near normalization of the output continues into the 8th week, but then look at what happens here. What happens from week 8 to week 12 is a drop off, and then by week 16, back to near baseline. What happened? They stopped taking the probiotic at the 8-week mark. What I love about the setup and the design by Gregor and colleagues is they looked beyond the intervention, and this helps us understand that, or answer the question that patients often ask in the clinic, well, how long do I have to take probiotics for? My answer is always, it's really up to your body. We're going to aim for the broadest diet, the minimal amount of supplements, but we also want to go through this wean off exercise and see what happens to you symptomatically. So in this case, if someone stopped at 8 weeks, they started to see their symptoms reappear. I'll show you the symptoms in a second, but stay with me on the cortisol awakening response. Abnormal, normal at week 4, normal at week 8, blunted at week 12, and nearly back to baseline by week 16. So this tells us, or at least it partially helps us make the inference that if a therapy, in this case probiotics, is working, stay with it for a reasonable time. I think trying to come off at 8 weeks is actually reasonable. But if you notice symptoms return, then go back on. Try to find a minimal effective dose. Then trial the withdrawal again. And if we're hitting the mark, you should be able to stay off of the probiotic or minimize the dose and still see a maintenance of the symptomatic improvement that you were receiving when you were on the full dose. Now, here are the IBS symptoms. And by the way, they're looking at a research-validated IBS symptom severity questionnaire, and also for scores of anxiety and depression, which also improved, they were using a hospital anxiety and depression index. This is important because they're using peer-reviewed and validated measures to show these symptoms could reliably be said to have improved. Now, what you don't want is a high level of symptoms, obviously. So they are high at time point 0 at the start. They drop at week 4. They drop further at week 8. Then they stop taking the probiotic and there's an increase and a further increase, although not as bad as baseline, but again, there is a returning of the symptoms. So taken collectively, I have a few thoughts I'll provide you in just a moment after we go through the conclusion. These findings suggest that the stress response is a major driver of IBS symptoms. The time course of the beneficial effect of combo, this is the 2-strain Bifidobacterium longum at 1 billion, on IBS symptoms suggests that this is achieved through a restoration of the stress response. Continuing, the time course of the effective combo, probiotic, on anxiety and depression in IBS, which both anxiety and depression did improve, paralleled anti-inflammatory effects as indicated by a reduction in circulating levels of TNF-alpha, an inflammatory cytokine. So what they're saying there is the IBS symptoms improved directly along with a lowering of inflammation. Leading to my few final thoughts on this. And as I've been saying now for many years, altered stress responses, cortisol, are oftentimes a byproduct of what's going on in the gut. So one of the things you could argue is, well, we have to test the cortisol so we know what's going on. And I would say, no, you do not. In this study, they did not use the cortisol levels to inform treatment. This is huge and very important to understand. This is a research setting, and they wanted to say, here's a number of patients with IBS, with anxiety and depression, with high TNF-alpha. We want to study the intervention of probiotics and then see what happens to these markers. What happens so often in the field of functional and integrative medicine is we're using tests from a research setting and trying to insert them into a care model. Well, we need to test the cortisol first to then know what to do. And that's not the case. And that's not what most of the research shows us. I make this delineation so that if you're someone who suspects you have a problem with cortisol output, you're fatigued, maybe you're not sleeping well, maybe you have anxiety or depression, the solution is not quantifying the cortisol. In this study, it was measured and it improved. But it improved secondary to a successful gut intervention, namely B. longum at a dose of 1 billion per day. So you can save the time and the money for the adrenal testing and go to the cause upstream, which is in many cases gut health. Leading to my second point, which is in part why we have stopped using adrenal testing at the clinic for over 5 years now. Because it's just not informative. Again, there's this crucial difference between interesting changes in mechanism that's part of the academic research process, on the one hand, needed to be done, versus in clinical practice, what amount of testing should be done to inform the use of, in this case, probiotics. The testing told us nothing about how to successfully treat the individual. It was used to help better understand mechanistically how do probiotics have their positive benefit. And as we discussed in the podcast in the past, there are other data showing that probiotics can improve sleep, anxiety and depression, and reduce inflammation, and also some early data showing improvements in fatigue. So if you or someone you love is struggling with these symptoms, please share this video and consider a trial on probiotics, because as you see here, so much interesting stuff can happen downstream if we get the gut health piece right. Okay, everybody, talk to you next time.